11 liver cancer warning signs. Liver cancer is a serious disease that often doesn't make itself known with clear signs until it's quite advanced. Our liver, a powerhouse organ located in the upper right part of our abdomen, is essential for filtering toxins, aiding digestion, and regulating our metabolism. When cancer develops in the liver, it may disrupt these vital functions and gradually lead to specific symptoms. It is quite shocking that the incidence rates of liver cancer have more than tripled since 1980. Moreover, the death rates due to the disease have more than doubled during this time. Being able to spot the early warning signs of liver cancer may significantly improve the chances of successful treatment. In today's video, we will talk about 11 warning signs of liver cancer that may help you detect this disease early and protect your life. Also, stay tuned till the end to find out the secrets to keeping your liver healthy. 1. Unexplained weight loss. Cachexia, which involves significant weight loss and muscle wasting, may manifest even in the early stages of hepatocellular carcinoma, the most common form of liver cancer, and in patients with compensated cirrhosis. It is more prevalent in every 1 out of 4 patients. When liver cancer develops, the tumor cells may disrupt the normal tissue structure and function of the liver. This disruption impairs the liver's ability to produce certain proteins and to process or store nutrients effectively. Moreover, cancer cells compete with normal cells for nutrients, often at a much higher rate. It may lead to malnutrition and weight loss. This process is exacerbated by the body's increased metabolic rate as it tries to fight off the cancer, consuming more energy in the process. Additionally, the presence of inflammatory substances produced by the immune response to cancer may also suppress appetite. It may alter the way the body processes fats and sugars, typically leading to further weight loss. 2. Loss of appetite. People with liver cancer often experience a loss of appetite, a symptom that significantly impacts their quality of life and overall health. This decrease in appetite, medically known as anorexia, is primarily due to the liver's central role in digestion and nutrient metabolism being compromised by the cancer. The liver produces bile, which helps digest fats and also acts as a medium to excrete certain waste products from the body. When liver cancer disrupts bile production, it may lead to difficulties in digesting food, especially fatty meals. It may make eating an unpleasant experience. This disruption often results in a natural aversion to food, as the body begins to associate eating with discomfort. Furthermore, liver cancer may alter the levels of various hormones and proteins involved in regulating hunger and satiety, including leptin and ghrelin. These hormones may usually signal to the brain that it's time to eat or stop eating. However, when their levels are unbalanced by liver dysfunction, it may lead to decreased feelings of hunger and a reduced desire to eat. 3. Upper abdominal pain. People with liver cancer often experience upper abdominal pain. It is a common symptom due to the location and function of the liver. This pain is primarily caused by the growth of the tumor within the liver itself, which may stretch the liver's capsule. The liver capsule is a thin layer of tissue that encases the liver. When it's stretched by a growing tumor, it may cause significant discomfort and pain in the upper right side of the abdomen, where the liver is situated. Additionally, as the tumor grows, it may start to press on adjacent organs and tissues. This pressure not only contributes to the pain but may also lead to a feeling of fullness in the abdomen, further exacerbating discomfort. The liver is in close proximity to other vital organs, such as the stomach and intestines. Thus, any expansion or shift due to a tumor may impact these areas, potentially leading to more widespread abdominal pain. Liver cancer may also lead to the development of ascites, which is the accumulation of fluid in the abdominal cavity. This fluid buildup increases pressure throughout the abdomen, contributing to abdominal pain. Ascites are often a result of the liver's decreased ability to produce proteins that help keep blood from leaking out of blood vessels and into body tissues, a key function of a healthy liver. In a study of liver cancer patients in Taiwan, the most frequent symptom observed was abdominal pain, experienced by about 76% of the patients. This pain, often dull and deep, was caused by the growth of the tumor mass in the liver. 4. Swelling in the abdomen. The liver plays a crucial role in regulating various substances in the blood, including proteins such as albumin. Albumin may help maintain the oncotic pressure in the bloodstream, which is essential for keeping fluid within the blood vessels. When the liver is damaged by cancer, its ability to produce albumin diminishes. With lower albumin levels, fluid starts to leak out of the blood vessels and accumulate in the abdominal cavity, leading to swelling. Additionally, liver cancer may impair the liver's ability to clear hormones and other substances from the blood. This impairment may disrupt the balance of fluids in the body, further contributing to fluid buildup. The liver is also involved in managing blood flow to various organs. As tumors grow, they may obstruct blood vessels within the liver, leading to increased pressure in the portal vein, the major vein that carries blood to the liver from the intestines and spleen. This condition, known as portal hypertension, may exacerbate fluid leakage into the abdominal cavity. When patients with a history of cancer, whether it's inside or outside the abdomen, develop ascites without having liver cirrhosis or other benign causes, this accumulation of fluid is typically considered to be due to malignancy. 5. Jaundice, yellowing of the skin and eyes. Jaundice is observed in 19 to 40% of patients with hepatocellular carcinoma at the time of diagnosis, typically indicating that the disease has reached an advanced stage. Under normal circumstances, the liver converts bilirubin into a form that may be eliminated from the body through bile. It is a fluid produced by the liver that helps digest fats. When liver cells are damaged by cancer, this process is disrupted. The liver may become less efficient at converting and excreting bilirubin, causing its levels to build up in the blood. As bilirubin levels increase, it may start to deposit in tissues throughout the body, leading to the characteristic yellow color of the skin and eyes that defines jaundice. Additionally, liver cancer may lead to blockages in the bile ducts, the pathways through which bile flows from the liver into the intestines. When tumors block these ducts, bile and consequently bilirubin may not exit the liver effectively. This backup not only increases bilirubin levels but may also exacerbate liver damage, creating a cycle that further impairs bilirubin processing. 6. White, chalky stools. People with liver cancer may experience white or chalky stools, a symptom that typically occurs when there's a blockage in the bile ducts. The liver produces bile, a digestive fluid that is essential for helping break down fats and for eliminating certain waste products. It includes the bilirubin that gives stool its normal brown color. When liver tumors grow, they may press against or grow into the bile ducts, blocking the flow of bile from the liver to the intestines. Without bile reaching the intestines, the bilirubin that colors the stool isn't excreted into the digestive tract. As a result, the stools may lack the normal brown pigment and appear pale, white, or chalky. This discoloration of the stools is medically referred to as a colic stool and is a direct consequence of the reduced or absent bile output. 7. Dark urine. People with liver cancer may experience dark urine as a result of the liver's diminished capacity to properly handle bilirubin. Bilirubin is a byproduct of the breakdown of red blood cells. It is typically processed by the liver, which modifies it into a form that may be excreted through bile. In a healthy liver, bilirubin is carried from the liver to the gallbladder and eventually to the intestines, where it may help in digestion. However, when liver function is compromised due to cancer, the process is disrupted. The liver might not be able to clear bilirubin effectively from the blood due to damage from tumors. The bile ducts might be blocked, preventing bile and thus bilirubin from being transported properly. When bilirubin levels in the blood rise significantly, the kidneys may start to filter out some of this excess bilirubin into the urine. As a result, the urine may take on a very dark color, similar to tea or cola, which is much darker than the usual pale or straw yellow. 8. Chronic fatigue. Fatigue is a prevalent side effect of cancer, often continuing for years after treatment has ended, even in survivors who are otherwise healthy. The liver is integral to various metabolic processes, including the regulation of sugar levels in the blood and the conversion of nutrients into energy. When liver cancer may impair these functions, the body's energy metabolism may become less efficient. This inefficiency means that despite consuming nutrients, the body may not be able to convert them into usable energy effectively, leading to persistent tiredness. Furthermore, liver cancer may lead to anemia, a condition where there aren't enough healthy red blood cells to carry adequate oxygen to the body's tissues. The liver plays a role in producing substances that aid in the creation of red blood cells. When liver function is compromised by cancer, this production may be hampered. It leads to fewer red blood cells and subsequently less oxygen being transported throughout the body, which contributes to fatigue. Additionally, the immune response to cancer may also be a factor in fatigue. The immune system may release various cytokines in response to cancer, which are proteins that help regulate the immune system and fight the disease. However, some cytokines may lead to inflammation and a feeling of being tired all the time. Moreover, the psychological impact of dealing with a chronic and life-threatening illness, such as liver cancer, may lead to or exacerbate feelings of fatigue, stress, anxiety, and depression, which are common among cancer patients, may also play significant roles in how tired a person feels, both mentally and physically. 9. Easy bruising or bleeding. Since the liver is responsible for producing clotting factors, patients with chronic liver disease often experience coagulopathies. It may lead to easy bruising and bleeding, particularly in the gastrointestinal tract. Additionally, liver cancer may exacerbate the condition known as thrombocytopenia, where there is a reduced number of platelets in the blood. Platelets are cell fragments that play a vital role in blood clotting. When the liver is not functioning properly, it may affect the production and lifespan of platelets, further complicating the clotting process. The liver also plays a role in regulating the balance of various other substances in the blood, including enzymes and other proteins that control clotting and bleeding. When liver function is compromised, this balance may be disrupted, leading to an increased risk of bleeding. Moreover, liver cancer may cause portal hypertension, which is an increase in the blood pressure within the portal venous system. This condition may lead to swollen veins, varices, in the esophagus and stomach, which are prone to bleeding. 10. Fever. Liver cancer patients who experience fever tend to have a higher percentage of neutrophils and larger tumors. Additionally, as liver function deteriorates due to the progression of cancer, the organ becomes less effective at filtering bacteria and toxins from the blood. Normally, the liver may help to remove harmful substances that enter the bloodstream from the intestines. When this function is compromised, bacteria may accumulate and potentially lead to infections, which may also cause fevers as part of the body's response to fight the infection. Furthermore, the presence of a large tumor or multiple tumors in the liver may lead to necrosis, cell death, within the tumor itself. This necrosis may provoke an inflammatory response as the body tries to clear away dead and dying cells, a process that may further contribute to the development of fever. 11. Nausea and vomiting. One primary reason is the liver's compromised ability to detoxify the blood. The liver filters out toxins and various byproducts of metabolism, preventing them from causing harm. When liver function is impaired by cancer, toxins may build up in the bloodstream and affect the brain and digestive system, leading to feelings of nausea. Additionally, liver cancer may cause changes in metabolism and the digestion process. The liver produces bile, which is essential for breaking down fats in the diet. If a tumor obstructs the bile ducts, the flow of bile is reduced or blocked, disrupting normal digestion and often resulting in nausea and vomiting, especially after meals. The presence of a large tumor or multiple tumors in the liver may also physically press on the stomach and other digestive organs, which may mechanically interfere with the normal function of these organs and contribute to nausea and feelings of fullness. Moreover, the psychological stress of dealing with a serious illness like liver cancer may trigger or worsen nausea. Stress may affect the stomach and how the brain interprets signals from the digestive system, making a person feel nauseous even without direct physical causes from the liver itself. Furthermore, patients with hepatocellular carcinoma often have associated conditions like cirrhosis and gastric esophageal varices. Severe nausea and vomiting in these patients may cause these varices to bleed, which is a serious complication that may lead to death. Now let's discuss how to keep your liver healthy. Maintaining liver health is vital for overall well-being. Here's how you may keep your liver functioning optimally with added context for each strategy. 1. Maintain a balanced diet. Consuming a varied diet rich in fruits, vegetables, lean protein, and whole grains helps provide essential nutrients that support liver function. 2. Stay hydrated. Water flushes toxins out of the liver and facilitates a more efficient metabolic process. Adequate hydration also prevents the liver from overworking, as it helps dilute substances that might be harmful. 3. Limit alcohol consumption. Alcohol is metabolized by the liver, and excessive drinking may lead to inflammation, a fatty liver, and even liver failure. Moderating alcohol intake may help prevent these conditions and keep liver cells healthy. 4. Exercise regularly. Physical activity may help to burn triglycerides for fuel and reduce liver fat. Thus, it prevents obesity-related liver diseases. 5. Avoid toxins. Exposure to harsh chemicals and pollutants may damage liver cells. Use protective gear when handling chemicals and ensure proper ventilation to minimize inhalation of harmful substances. 6. Prevent infections. Viruses like hepatitis may severely affect liver health. Simple hygiene practices like regular hand washing, avoiding shared needles, and having safe sex may prevent these infections. 7. Control weight. Excess body fat may lead to non-alcoholic fatty liver disease, which may progress to more serious liver damage. Managing your weight through diet and exercise may prevent these outcomes. 8. Quit smoking. Smoking contributes to oxidative stress, which may cause inflammation and fibrosis in the liver. Quitting smoking reduces these risks and supports overall liver health. If you experience any of these symptoms persistently, it is important to consult with a healthcare provider who may perform appropriate tests, such as blood tests, imaging studies, and liver function tests, to determine the cause. Awareness and early intervention are key to managing liver cancer effectively. Regular checkups and being mindful of bodily changes may help in catching this disease early, leading to better management options and outcomes. Today we learned about all the symptoms that you may experience at different stages of liver cancer. Similarly, you may also find out when your heart might be at risk. Want to find out more? Watch 10 warning symptoms of a hair stroke 1 month before it happens. Or watch 12 early warning signs of heart disease your body is telling you about. You may watch either or both of them. Do you know any other signs of liver cancer that were not mentioned earlier? Let us know in the comments section below.